A pleasure to have you join us today on the program Healthy Living. I'm Adisuwa Osawagye. Today we want to look at cervical cancer. What is cervical cancer? Why should we talk about it? Why should every woman come out to listen to this topic? Because it concerns you and you alone. It does not happen to a man. A man has got absolutely nothing to do with cervical cancer. It is a woman's problem. Does he have age limits? Today you would know. How would you know that you have it? Sometimes people mistake signs and symptoms of cervical cancer for maybe UTI, or maybe, you know, some would say toilet disease and all of that. It goes beyond that. And often a time, when you now see signs and symptoms, that means you're almost gone, particularly those who have this very poor habit of going for medical care. Most women don't like to go for medical care, but we could buy the most expensive clothes for ourselves. Yeah, because women love fashion, and we could do anything just to look beautiful on the outside. What about in the inside? When things are going wrong with you, how would you know? When you have a poor attitude to assessing health care, something that will not kill you, that will even make you better. Anyway, we're going to do that today, and I have with me a strong medical personnel in the house. She's Mrs. Stella Otaigbe, and she's going to be talking to us today on cervical cancer. It's a pleasure to have you join us today.
Good afternoon.
Yeah, thank you. Good afternoon.
Thank you so much.
Thank you.
Yeah.
Now we're looking at cervical cancer. Thank God you're a woman, and so you'll be able to explain things to us so that everybody out there will know exactly what we're talking about. If your wife is not around, as a man, listen, watch, hear every point that's going to be talked about today, and so that you can educate your wife. Perhaps she will be able to go check herself up, okay? That's that for you. So, Stella, talk to us. Cervical cancer, exactly what are we talking about?
So when we talk about, good afternoon everybody in the house. I hope you're all listening to this program that is very educative to the women. It is women issue. When we talk about cervical cancer, we are talking about that cancer that affects the mouth, what you want to look at, either the mouth of the womb. I want to go down to the level of the persons in the house. Cervical cancer has to do with the mouth of the womb. When, you know, the normal cell there just sit down and begin to grow, you know, unnecessarily, and then erupt, you know, that's very part of the body, and then, you know, starts other cells around there of their normal nutrient, and it now becomes a problem. The woman will manifest by first having pains during sexual intercourse, either before or after, and then there is usually bleeding. If this woman sleeps with her husband, you know, there will always be associated bleeding. This woman, some of them, they are already attained menopause, they have already stopped, you know, the process of menses. They just see bleeding again. That is a sign, a warning sign that there is, you know, a bullet around the way that's about claiming a life. And then some persons manifest by having, you know, back pain, consistent back pain. And for some persons that will have been having normal bleeding, you now discover that normal vaginal bleeding, when I say normal vaginal bleeding now, menses, it now becomes abnormally prolonged. Sometimes after even the menses, you see another revisit of bleeding, then that should tell you that there is a problem around the corner. And cervical cancer is as deadly, is one of the most deadly diseases that claim the life of women every day. Every year, cervical cancer claim about 200, you know, lives of women every day. It's a thing that require attention. Now, what are the causes? One of the very good causes that we can look at here is the cause is what? Human papilloma virus is the causative organism of this very cancer. And in another place you look at it, they can be caused by genetic, maybe when I say genetic now, it means it runs in the family. Maybe one's mother had it, and then another person's gene can be a carrier of this, you know, cervical cancer. You see that this woman again is going down with cancer. So when the woman start, you know, having all these signs and symptoms that I just talked about, then you know that you should visit, you know, the hospital. There are ways to prevent this cervical cancer from occurring. One of the very good ways is you as a woman, every year you should endeavor to visit the hospital. Go for medical checkup. Visit the doctor. Let them go to health center. Let them check you. If they check and they see that you present with any of these signs and symptoms, and then the first thing they are going to send you for is for pap smear. Pap smear is a test that is done every year for every woman. Every woman should on her own sit down and just walk to a health center, walk to UBTH, walk to Central Hospital, walk to any good hospital and tell them, I want to do pap smear. In pap smear, they just check you, and then they find out if you have any kind of cells that are developing that are going to be cancerous. When they see, they quickly know exactly what to do. But by the time we are careless, like, you know, the moderator said just now, we women, we lack fashion so much. Some of us can afford to buy hair for 300,000, human hair,
even more,
for 300,000,
even more.
You know, buy clothes. Some of us can even go and rent clothes to wear, borrow clothes, but we pay little or no attention to our care. We don't just, you know, bother to care for ourselves. All these things are some of the things that, you know, should bother us, the woman, bother you, the woman. Every year, whether you have started seeing this or not, what you need to do is, you know, go for medical checkup. And one of the very big preventive way that we can use to prevent this cervical cancer is to take our children that are between ages 11, our female children between ages 11 to 13, take them to take this HPV, you know, vaccine, human papilloma virus vaccine. When they take it, the chances of their having cancer in future is very, very thin, if not zero.
Okay, this vaccine you're talking about now, as one may want to ask if it's good for girls who are not sexually active to take this vaccine.
Yes, of course, yes. The girls that are not sexually active are the ones that should take it. When they are already sexually active, you know, that vaccine will not do anything. But it's essentially for ages 11 to 13. That is the age at which, you know, you give them the vaccine, and it's very, very effective.
Is it free? And where can we get it?
If you go to UBTH, you can take it in the UBTH. You go to our Ministry of Health, you can take it there. Central Hospital, they have it there. It's not too expensive. It's almost as if it's free. It's affordable. You know, if you have your young girls, you know, young girls between ages 11 to 13 that are not yet sexually active, please take them. You know, either to Central Hospital, to UBTH, or to our Ministry of Health. Let them go and get vaccinated against this infection called cervical cancer. There is a deadly disease, like we have just told you. It doesn't ring bell until it wants to kill. So that is why you must learn to take care of yourself and screen yourself.
You know, even when there are signs and symptoms of a particular ailment, not necessarily cancer, it's difficult for a woman to just stand up and say, I will manage, and before you know what is happening, she may just die. But now in the case of cervical cancer, no signs, no symptoms. By the time you're seeing signs and symptoms, that means the person is already gone. At that stage, what is the woman supposed to do?
Yes, as soon as she gets to know that, oh, there is now bleeding during intercourse. Ordinarily, with everything being good and the man knows how to do foreplay with the wife before sexual intercourse is not supposed to be painful. But by the time a woman now discovers that, oh, each time my husband is meeting me, it is usually associated with pain, then you know that there is a problem. There is a problem. At that early stage, you will not start experiencing bleeding. There will not be bleeding at that initial stage. You know that there is a problem, then just go visit a medical doctor. Go visit health center. From health center, they can refer you to, you know, secondary level of care. From secondary level of care, if it is what they can still handle, they take care of it. They cannot handle, they now send you to the tertiary level of care, which is our University of Benin Teaching Hospital. Again, if you now see that your menses, you know, that have stopped before, as a woman that have, you know, attained menopause usually set in between age, depending on you and your family line and your tree. Menopause usually set in between age maybe about 35 to about 50. It extends to about 50 in some family, and you know see that you have stopped menstruating, and all of a sudden you just discover now that you are now bleeding. It's a warning sign. quickly go to the hospital. By the time you detect this thing early, to remedy it will be very, very, very good, which means it will still maybe be in the first stage or the second stage. But by the time it enters into the third and the fourth stage, then there will be a problem. But whatever be the case, you know, drugs can be used. You know, drugs can be used to treat, and if it gets so bad, they can decide to remove, you know, the woman's other part of the cervix that is affected, or remove the entire fallopian tube, the uterus, and everything, ovaries about the woman, to just to save her life. It's better that this woman stays alive without her woman reproductive organ and still enjoying her normal sexual life than to go and die.
But of course, when it gets to that stage where you have to do a hysterectomy, that's what it's called here. What you have to do, whether partial or total hysterectomy, a lot of women don't want to do that, because there is this myth that if you remove any part of your body as a result of surgery or operation, as the case may be, in the next life, the person will not come back again with that. So no woman wants to live without children. So the moment you talk about hysterectomy, particularly when the cancer is really, when the cancer started going bad, women don't want to listen. I know somebody who is supposed to do a hysterectomy, and she's running from pillar to post, and with faith, a lot of things as women. She's running from pillar to post. She's running from one hospital to another, from one church to another, believing that there's a miracle solution. There's a miracle. I believe in miracles too, but you know, sometimes you do things that ought to be done. Okay, we don't fit everything. And in such a situation, what happens to such a woman? She dies, yeah?
Yes, we have seen several cases. Before they now come to us, it's beyond, it now goes beyond repair, and oftentimes they lose their lives. If well, depending on religion, we are not here to preach religion, but I personally do not believe in life after now. Even if there is life after now, why don't you live this life well now? Live this life well. If you believe that there will be life after now, live this, cross this
one well
first, and then live well first, and then if there's another one, then when you get there, you now know how to cross the river. But I personally do not believe that there is a reincarnation. So if you are diagnosed of having cancer, all you need to do is to quickly seek remedy. If you are dictated on time, if you are found on time to have any kind of cancerous cells, remedy can still be available. But what do we see today? Because of, you know, some of these persons that go to where they are not supposed to go to, wrong churches, they start faithing them. Do you know that it is doctors that have, you know, made all these ways available for us to, you know, get at, bring out all these problems? It is God that gave doctors wisdom, knowledge, and understanding to be able to, you know, intervene and then either provide chemotherapy, radiotherapy, or surgery, you know, for this woman to live. Why don't you go and get, you know, any of these things done so that you can live well for yourself now and for other members of the family? You know, one essential thing in Nigeria that we live it, your life is not just your own. You know, family members, friends, they care. I don't know whether you've ever been sick before, anything has ever happened to you. You now know that, oh, I live in a wonderful environment. I remember when I lost my mother, I like, wow, look at people, friends, you know, relatives everywhere calling all over, and I like, you know, when something is going wrong with you, it's not just you, but your entire family, your friends are affected. Why don't we live well for them? If you have found early that you have anything that has to do with cancer, there could be remedy. Please run. But one thing I want to say, let us learn to, you know, pay plenty importance to medical attention. Sit down. I don't know how many of us have ever sit down. Like I'm in a hospital. You know, you can hardly see anybody coming to say, oh, I just came for checkup. No. I just want to see how I'm doing. Nobody comes. No. Except when
it's not in our character.
They don't come. Even when the ailment is at the early stage, they don't come until, you know, the team will almost want to be claiming their life. That is when you see them run. Emergency. And they tell you, oh, emergency, I might have an emergency. And then you begin to, sometimes when you look at medical personnel and every other person in the hospital looking, you know, at this person's coming, did the sickness just start today that you are running an emergency? By the time you take history from this patient, you see that it's not just this week, it's not just this month, it's even not this year. It's been there, but nobody pays attention. But they can pay attention to irrelevant things, especially women. Let us be cautioned. You can buy clothes of how many thousands, you can buy wig of how many. Why don't you just stroll to a hospital? Pap smell is no more than pap smell. you know, for you to just walk to a hospital and do pap smear is just 3,500 to save your life. Just 3,500. What does this pap smear do? By the time they take the pap smear from the woman's, you know, mouth of the womb, from the cervical region, they check the cells there to see whether they are already going cancerous. If they're already going cancerous, they check at what level is this thing now. What can we quickly do now? Oftentimes, you know, persons are remedy at this stage. So please, my women, let's take our health very important. Visit the health center, visit specialist hospital, visit UBTH, visit any good hospital, private good hospital that you know that they are, you know, really sound. Visit them. Just walk in there, tell them, I want to check my status. I want to do pap smear. It is called pap smear. They just check it for you, and after some days they tell you to come back, and at the end of the day they give you result. Oh, madam, congratulations. Oh, madam, you have slight, you know, changes. Let's quickly see what we can do.
Okay, now women, pregnancy is very important to a lot of women, to every woman. Now let's look at the situation where a woman is pregnant and then she also has cervical cancer. Is it possible for a woman to be pregnant and still come down with cervical cancer? That's one question. And the other one is it possible for a woman to get pregnant while suffering cervical cancer? Two questions in one.
Two questions. They are like two questions in one. It is hardly, you know, seen. Why? Because by the time the cancer cells are in there, like I told you, they rub every other organ around there of their normal food nutrients. That when, if possible, that, oh, this woman possibly gets pregnant, you know, the cancer cell will not even allow the baby to strive. It will not allow the baby to strive. You know, the cells there, the way they grow so much that any nutrient in there, they just grab it. So the one that's even meant for the baby, they grab it. So if peradventure there's even any sense of pregnancy, before you know it, this woman is having, you know, abortion, spontaneous abortion, because of the presence of the cancer there. It's hardly seen. Very, very hard to see, and if it occurs, the baby will not survive, because the cancer cells there, they also rub all those organs there of their nutrient that you know, nothing gets to the baby. Before you know it, there is, you know, normal abortion, spontaneous abortion set in.
That's very sad. Does fibroid have anything to do with cervical cancer?
Fibroid is abnormal growth. It's abnormal growth, but it's not cancerous. When we are looking at growth now, when you look at growth, we have what we call fibroadenoma. We have what we call fibroadenoma. We have what we call carcinoma. Fibroadenoma, they are from fibrous tissue. They just grow. You can get a woman having fibroid, and then by the time you look at the woman's tummy, you think the woman is like 9 months pregnant. She'll soon give birth. You know, we can have a fibroid as big as, you know, that ball that, you know, they play, big football. You can have some fibroid that will be so tiny, tiny like sand. They'll just be everywhere there. Those big ones are better. By the time you remove them, there's every still good chances that, oh, this woman can still have, you know, the opportunity to have, you know, to become pregnant. But those ones that look so tiny, they will just be everywhere. Sometimes the O&G doctor will remove and will peel and pick. You cannot totally eradicate everything. Those ones, they disturb the chances of being pregnant. When a cell is cancerous, it's deadly. Then when it is fibroadenoma, it's from fibrous tissue. Once you remove it, you send it to a pathologist. A pathologist will check and tell you, no, it's not cancerous, and it goes. Yes, fibroid is quite different from cancer.
All right, we talked about hysterectomy a while ago. Is it possible medically anywhere in the world where a woman who's gone through this surgery will still come down with cancer?
A woman that have had total hysterectomy,
whether total or partial, is it possible?
Yes. When you say whether total or partial, it's still possible for them to still come down with cancer. Do you know why? Depending on at what stage was this surgery done. If the surgery was done at the late stage, where, you know, the cancer have really spread to other organs, other organs are partaking in the spread of this cancer, and then gradually those organs will start growing. And then they'll start, the cancer cells that have been spread to other organs will start growing. So you'll not be surprised that this woman that had either partial, when you say partial, now maybe they just remove only maybe the uterus, and maybe they just remove the uterus, they left the fallopian tube, they left the ovary. But by the time, if they remove maybe only the cervix, and then the thing has spread to the uterus, you will expect the woman to come down. Wow. With cancer again, even after the partial. Or if they have removed the woman's fallopian tube, the uterus, the cervix, and then even the ovaries, yes, and the thing has already spread to surrounding organs inside, the woman will still have other form of, we have different kind of cancer. We can have cancer of the colon, we can have cancer of the duodenum, we can have cancer of different organs of the body. All the organs of the body, they are prone to cancer. All organs of the body, the eye, the nose, the mouth, every part of the hand, the leg, every part of the body, they are prone to cancer.
Now let's look at chemotherapy. Some persons will say that chemo kills faster than even the disease. Are you going to disabuse our minds about this, or you're going to confirm it?
Yes, chemotherapy, when you say chemotherapy now kills faster than the disease, it's not true. Depending on, again, like I say, at what stage did you bring this woman in now for chemotherapy? At what stage did you bring her in for chemotherapy? If you brought her in early, then the prognosis will be very good. When I say prognosis now, it means recovery rate of this woman. It will be very good. But if she came in really late, when so many organs would have been destroyed, then it will be poor. It will be poor. And then another thing again is this woman's state of mind. Some persons, they die faster because of fear of the known. They know that this ailment is unto death, will kill them. This ailment can kill. Even before the ailment start destroying, they kill themselves. Even they die first before the ailment come and start carrying on.
That's quite sad. And that there's something called a support group. But unfortunately, women don't want to come together. Women who have this kind of problems don't want to come together to have a support group. And even if there's a support group, they don't like to go because of the issue of stigmatization. Make them not laugh me. Yeah,
you are right, my sister. But I think we are going better by the day. If you come to Central Hospital now, we have support group for HIV, we have support group for diabetes. Even as tiny as diabetes is, some persons are still shy to come out and say I have diabetes, as if it is,
It is the issue of stigmatization.
That is the issue of stigmatization.
People, I don't know. Okay, if you watch some foreign channels, you see people come out freely.
Yeah.
I was watching this Judge Judy or something, and he came out to say that, okay, this is it. The guy is leaving her because she's always taking her drugs. The guy is not comfortable anymore because she's diabetic and all of that. Beautiful lady. And I was like, oh, this is nice for a young lady to come out to say this. But here in this part of the world, people will laugh. I don't know why it's like that with us blacks. For whatever reason, people will just find a thing to laugh at somebody about. If you're quarreling, the next thing is, that's your sickness. If I actually heard somebody say that your sickness has gotten to your head, and it's quite painful for somebody to say that to another person just because that the person is going through all this. So how can we help ourselves, to key into the support group? Because I know that I've benefited from support groups, So if people can key into support group, I'm sure a lot of women will be safe, they will be happy. So how do we tell our women out there, if you're suffering from one ailment or the other, to key into a support group?
One word that I have to give to our women is that live your own life. Here in Nigeria, what we do, we live other people's life. Before anything happens to you, I don't know whether you have ever thought about it. Before anything happens to you, you are like, hey, what will people say? You are not even thinking about yourself. You are not even thinking about yourself. You jump into conclusion, hey, what will people say? People will laugh at me. My dear women, live your own life. Learn to live your own life. Don't live other people's life. Don't live other people's life. Don't live your life for other people. Just live your own life. Think about yourself. Don't think of other people. Think about yourself. If you have respect and regard for yourself, look for help for yourself. Don't bother. There's one thing in life. Everybody, we all have our own I don't know whether you like it or not. Everybody, you have one place or the other where your shoe is pinching you. There is nobody that is free. That is why WHO define health as a state of what? Physical, mental, spiritual, and a state of what? Well-being. It's not merely what? The absence of what? Disease and infirmity. We all have one thing or the other. Some people have, hypertension. They just carry it around. They live with it. They live with it. If they don't tell you, you will not know. Some, they have diabetes. They live with it. If they don't tell you, you will not know. Some have one problem or the other. If you have support group, there are support group for cancer. Why don't you look for them and join them? Don't bother about what people will say. Bother about yourself. Bother about your health. Live your life for yourself, not other people's life. Don't live other people's life. In Nigeria, we are so concerned. Before anything happens to you, say, hey, then go laugh me. Hey, waiting people go talk. No, waiting you go talk. What concerns you?
All right, the number is 052290573. We want to take your calls now. A man can call to ask questions on behalf of his wife, because we know that some persons, after the program, you see people calling me to say, hey, I didn't want my voice to be heard. So whose voice do you want to be heard now? That's the same thing we're talking about. People will laugh. Let them laugh. It's their mouth. In as much as you know that you're getting help, you're living healthier than you used to, please call into the program. It's 052290573. I was reading something on the net, and I got to discover that cervical cancer do not kill women as much as it does in Nigeria, because they present early. They go to the hospital. Once, is there age limit? From that cancer can get to about 64. From it's very, very common. You see it common between age 26 to 49, and then you get again from that 49 to about 64. But where you get it really, really, common is from that 49 to 60 something. That's where you get to about 64. So at what age would you advise women to do pap smear?
Women, as soon as you start giving birth. As soon as you start giving birth, or you are sexually active, whether you give birth or you're not, you're sexually active, go once every year. Go for pap smear every year. It doesn't take anything. Just 3,500 to know your status, to know your cervical status. It doesn't take anything from you. It's not expensive. You should go every year. And then it's commoner. This cancer is commoner with girls that are sexually active, that have multiple sexual partners. Girls that are sexually active, that have multiple sexual partners, they sleep with this, sleep with this, sleep with this. At the end of the day, all the infections put together, now stir up the human papilloma virus to now start producing and start causing, problem. And again, heavy smokers, they are, very, very prone to development of cancer. Why? Because smoking reduces their immune status. And by the time their immune status is reduced, any little infection, we just sweep them off the ground. And then for those that already have immune compromised, problem, for example, HIV, their status is already very, very reduced. Immune status is already very, very low. CD4 cell count is very, very low. Because it's very low, any little infection, they catch it. So let us learn to visit the hospital to do pap smear once a year. Once a woman have attained about 20 years and above, and you are sexually active, come for pap smear once a year. Once a year will do you a world of good. Now, you talked about back pain, that sometimes, the symptoms present as terrible back pain. Now, let's not get people worried, because is that the only reason that can give somebody back pain? No, so many things can give rise to back pain. So many things can give rise to back pain. Not just that one. For you to establish whether it is that a back pain is coming as a result of cervical cancer, you must visit the hospital. Who will visit the hospital? Well, then you see a gynecologist who will examine you and tell you that, this is the result, this is the thing causing your back pain. Okay, what about severe stomach ache? Severe stomach ache. When you talk about stomach ache, now the stomach is different from the pelvic region. The cervix is in the pelvic region, and then the stomach is where it's the place that harbors your food and your stomach.
So they are not related. Okay. Hello, caller. Good afternoon. Hello. Hello. You must note that according to Stella, there are usually no signs and symptoms. And when the symptoms begin to present, that means they can don't delay you know. Like how many stages do you get to? You talk about stage 1, stage 2. How do you determine the stages?
Stage 1, the thing is just at the mouth of the cervix, just around there. When you talk about stage 2, it's spreading to, the uterus. And by the time you talk about stage 3, it's going to the fallopian tube. Stage 4 is going to places. All of those organs, just like that, from, from one stage to the other. Is
it possible for one to just, these days, I just have to say it, women look at themselves. They just get a mirror, look at themselves and all of that. Is it possible for a woman to see it that way?
To see whether you have cancer.
Yes.
The only way that a woman can look at the mirror and look at yourself and say, Abi, do I have cancer? Is when the cancer have really dealt with the woman. The woman have passed this pain stage. He has passed the bleeding stage. Is constantly experiencing this bleeding, and then she's not paying any attention. Then there will not be wastage of muscle. You not see that the woman would not be going lean and lean and lean. She'll not go cachetic. She'll just be so reduced. It will be so bad. Cancer can be as terrible as that this woman will now start losing her hair. On this woman's head that was so, the head that was so full of hair, it will get to a stage where the hair will start falling. The hair of this woman will start falling. But then that time, the woman will look at herself and say, hey, I am already in for it. That is at the very, very late stage. Then it would have extended to other organs in the body, and it would have been really, really bad. It would have gone to the blood, gone everywhere. It would have been really bad.
Okay, we'll come back to that. Hello, caller. Good afternoon. 0522905573 is the number. It is there on your screen. If I'm too fast in calling that number, just check your screen. You will see that number. Call. Oga, call on behalf of your wife. Madam, call on behalf of yourself. Sometimes women experience pain during sex, but unfortunately, nobody wants to talk about it. It is taboo in most places to talk about sex, what you feel about it. Nobody wants to talk about it because nobody wants to be called spoiled. Yes, nobody wants to be called spoiled. And some persons live in self-denial. You know that your kids are already active. They have multiple partners, but nobody is saying anything. We just feel that the thing will just glide and slide away like that. But when it gets to that stage of cancer, we begin to catch one which or the other without really going to the hospital. I'm just hoping and praying that with this, you will, at least do yourself a favor. We're approaching the end of the year. You can actually give yourself a gift. It could be your birthday gift to yourself. Sometimes when we talk about birthdays, you see a lot of us women, we're planning on how to hold a big party. There's nothing wrong with that. We're planning on how to go take our friends to eat this and all of that. And you spend more money than what you're going to spend having a pap smear. Simple procedure. It does not hurt. Even when they say free, sometimes some organizations will come and say, okay, let's sponsor this free. Some persons will just not come because they don't see it as important. Know it today that cervical cancer kills faster than you know. It does not have signs nor symptoms. By the time you begin to experience signs and symptoms, time don't go. Hello, caller, good afternoon. Hello, good afternoon. Please come and ask your question. Good afternoon. Hello, good afternoon. Thank you. Speak up a bit, please.
The person with the one I give age 1 to 13. I don't know the name of the one you mentioned just now.
Vaccine that you can give your child, a girl child, yes. Vaccine. Okay,
HPV vaccine. HPV vaccine.
You don't hear him?
HPV vaccine. Just waka enter any hospital, go UBTH, go Central Hospital. Just tell them say you want to give your pikin HPV vaccine. But make sure say that your pikin, you dey look am well, not be the one when call your co-tenant don dey sleep with not be the one when landlord don dey follow dey sleep not be the one don dey sleep with in classmate for school, make sure say your pikin na still innocent pikin. Now that time, now the thing go work. Between 11 years and 13 years, HPV vaccine. Waka go Central Hospital, Waka go UBTH, the vaccine they there. Thank you.
Why is the age pegged at 13? Why not 15? Why not 18? There are some innocent girls who are 18, 20, thereabouts.
Yes, when we are very sure, you are very sure that this child is still innocent, we give. We give. Just like if you look at, you know, the trend, you look at, you know, the sexually active group. By that age, go to secondary schools, go and see all the things they do in secondary school. You'll be so amazed. You'll be so amazed. You know, they say between 11 and 13, because at that period, you still expect that these children, they are still innocent, very, very innocent. But if you have a child who is even up to like 15, 16, 17, you are sure that this child is still, you know, a virgin, okay, not good, sexually active, you can still bring the child with.
Now, I want to ask, why would the vaccine not work when that child is already S-active?
Because there's already introduction. There is already introduction of the male, you know, male and the woman already coming together. There's already introduction of some kind of organisms that are being introduced from another person to, you know, to the female party. So that can stir up. That can stir up the development of, you know, the virus.
Okay, hello. Hello, good afternoon. Oh, that caller sounded so. Good afternoon. Good afternoon. Reduce the audio level on your television set. All right, quickly, talk to us.
Please, my question is that is ulcer good?
What's the problem with ulcer?
No. One time, when my mom took me to the hospital, they said that I have ulcer.
Okay.
So
what question do you want to ask now about the ulcer that they said you have?
I don't know the exact name of the ulcer.
Okay, you don't know the exact name of the ulcer. You will go back to that hospital and ask them. You know, tell your mommy to take you back to that hospital and ask the name of that ulcer. All right? Okay, 0522900573. You know, sometimes when we bring up some topics, persons don't want to call in. They don't want their voices to be heard. But after the program, you say people bombarding you with calls. It's very unfortunate that at this age and time, even though people are not seeing your face, we're still very scared of doing all of this. Hello, caller. People will always talk about you. People talk about those who have even gone beyond. Not to talk of you who is alive. Do your own thing. Live your life, women. You know, the way we do our things is quite different. Hello? Hello, good afternoon. Thank you. What's the name, sir?
Yeah, this is Mr. Peter speaking from Ukumoku.
Okay, go ahead with your question, Mr. Peters.
Yes, I'm so happy. I'm just in the office listening to your program.
Thank you.
My wife used to complain of itch in her back. Itch.
Itch.
So you used to feel some itch in her back. So I was thinking, I said, what could be because of that?
Okay.
When you talk about back pain, you can have pain from lumbar region of the back. You can have a spleen disc. You can have, you know, pain as a result of spondylosis, even coming from neck pain, you know, extended because of the nerve that sweep through that place. For you to know what is really causing that pain, you need to send your wife, you know, to the hospital. Let us see your wife. Let's examine your wife in the hospital, whether primary health care center, central hospital, UBTH, or any good private hospital. Send your wife there. Let them examine your wife and know exactly what kind of pain she's having, where the pain is coming from.
Okay. So it's not a case of hot ointment, hot water,
not at all,
and all of those massage. Go to the hospital. It doesn't cost you anything. Hello, caller. Good afternoon. Kindly reduce the audio level on your television set. If you do that, you'll help us and help yourself. All right, please, when you're calling in, reduce the audio level. Sometimes I feel very embarrassed saying this. Reduce the audio level, reduce the audio level. We already know what to do, okay? You cannot call in and listen to yourself at the same time. Hello.
Matthew, what's the vaccine for?
The vaccine. Okay, HPV.
Vaccine.
Did you get that?
Hello?
HPV.
Okay.
Just go to the hospital and ask for that. HPV, okay?
Okay, thank you.
You're welcome. Now, some persons may not want to take their children for this. You know, this God forbid thing is not our portion. You know, why should we take our... Just encourage us to take our daughters to this for this vaccine.
Yes, the vaccine is so essential for the prevention of, you want to prevent this cervical cancer for your child, you know, for your child. You want to ensure that, oh, in my child's lifetime, my child will not have cervical cancer. From age 11 to 13, parents, please take your children. Come to specialist hospital, go to UBTH, you know, go to any primary health care center near you. They will tell you where and how you can get the vaccine. Let them, you know, have it. Just that the vaccine is just like the
is it once for a lifetime?
Yes, once for a lifetime. It's just like the OPV vaccine you give to your children at birth to prevent polio. You just give this HPV vaccine to prevent this human papilloma. Is human papilloma vaccine. You know, just give it to prevent this human papilloma virus attacking your child later in life. It's a thing that every, you know, parents that still have children within that age limit should do for their children. Take your children, take your grandchildren to the hospital. Tell them you want this HPV vaccine for your children so that you'll be able to prevent this life-threatening infection, you know, that kills for your child. It will be a nice thing. They will remember you for good. Please. It's a thing that every parent must do for their children. This Christmas, even if you don't want to kill goats, you don't want to kill fowl for them, just take our daughters.
Yes.
Take them to, you know, either Central Hospital, UBTH, or any good private hospital that will have, you know, this vaccine. Take them there. Let them take this, you know, vaccine. They'll be thankful to you. They'll be grateful to you all their life. My parents, please don't forget to do this.
Okay. All right, 0522900573 is the number. Hello, caller. Good afternoon.
Hello?
Hello, good afternoon.
Good afternoon. Hello?
Hello, I can hear you. What's your name, please? Okay. Hello. All right, when you say hello, you wait for my response, okay? Because before, you know how this thing is, it has to transmit and all of that. The engineer is not here now to explain all of that process. Okay, so just give us a call on 0522900573. Hello? Hello? Okay, if peradventure one parent had cervical cancer, is it possible for the child or the grandchild to have? Is it a hereditary thing?
Sometimes it's genetical. It's genetic. You see that, you know, the cancer runs in family. Somebody will come and tell you, my mother died of cancer, and then it's genetic. Some of the children we have, you know, the gene dominant in their gene. It may be they, you know, that will have the problem. It could be their children. It could be their, just like you have this albino. Some have recessive, you know, some have dominant. You just have some of these children and you just see the thing just blow out. You give birth to albino. Meanwhile, some will have dominant. It will just be there. It will just be there. Silent. You marry somebody who is black. We've had cases like that in the hospital. Two fine black people or two chocolate people, they get married, they have children, and by the time the baby is jumping at it, all pure white baby. And no, I'm not the owner of this baby like that. So sometimes it's recessive, sometimes it's dominant. Sometimes children are lucky not to have it, but some of the children will still, you know, have it. It's a genetic thing.
Okay, let's look at drugs. Are there drugs that can cure cancer? Because I've heard people, particularly on social media, you see a lot of things.
Well, before I talk
then
about...
you see people bring out a lot of supplements, a lot of plenty herbal, many things. Okay, let's take this call. Hello, good afternoon.
Good afternoon, ma'am.
Thank you. What's your name, please?
My name is Mrs. Osaibovo.
Okay, Mrs. Osaibovo, ask your question.
My granddaughter, 12, the one is about getting to 5 years now. The other one is 4 years plus. They don't wish to take the vaccine.
When they are 11.
When they are 11.
Okay, they never reach, have they?
No, they never reach. From 11 to 13.
But for me, I feel take her. I'll be 51 years old.
No.
Okay, can she take it?
No, what you can do, Mama, what you can do is that go for pap smear. Every year, just come to hospital, whether UBTA specialist, you can go to Lily, you can go to this BMC, just go there. Go to any good hospital around. Just go to any good hospital around. Tell them you want to do pap smear. Do pap smear in Central Hospital. I think I have somebody that went there some time ago. In Central Hospital, they do it every day. Pap smear is just only 3,500. That is what you, who is above that 11 to 13 years, can do now. Just go there every year. Once a year, they just check you. They check to see whether you have any cell trying to develop into cancer.
You, God bless you.
God bless you, man.
After hysterectomy, is one advice to go and do the pap smear?
No, after hysterectomy, pap smear,
Everything
cancer
is gone.
No, everything is
Hey,
gone.
now,
Everything
the
is
life
gone.
of a woman
Yes, you were talking about drug being
The life
used.
of a woman is very interesting.
You were talking about drug being
if
used.
There are drugs,
yes, you reminded me. I
all of these
forgot
many
something.
things. Okay.
One of the things that causes this cancer again, you know, for girls, are these girls that take these daily pills, preventive pills, family planning. They take it on a daily basis. It can cause, you know, cancer too for them.
But we've been told that family planning pills don't do that. There's no side effect. It's good. It's a smooth sailing thing.
All these girls, they take it from when they are young. You know, they keep taking and then, you know, the thing
That
just
is
tear up.
when you abuse
You
it.
abuse it and then just tear up, you know, these cells. And these cells just start growing, you know, virulently. And before you know it, it's cancer. So, girls, please, zip up. Keep yourself for a better tomorrow instead of wasting your life sleeping around. You know, by the time you keep doing that, keep using that, and women too that use it for family planning. Once you are 35 years old, do not use pills. Pills are no longer advisable. Once you get to 35 years old, go and see your family planning provider. They will find out the one. They will educate you. They don't choose for you in family planning. They will educate you, and then you will choose another appropriate method that you can use. Maybe you have used it for, you know, a long time. You've used it until you are 35. Once you are 35,
maybe from 18 to 35.
Yes, you have used it from maybe 18 to 35. Once you are 35, please stop. Go and meet your family planning provider. They will show you all the different methods of family planning, and then you will make a choice of the one you want to use. Okay,
we're still on the drug thing. Are there drugs you use to cure cancer? Is it curable? Because we see a lot of the traffic is so massive, and then you see people subscribing, and I take time to go through all of this, and most often the time you're helpless.
Yes, what you should do, my sister, my co-women that are at home, visit the hospital. Let an O&G doctor see you. Let them see you. Let them assess you and know what kind of drug you need. All those, you know, social media, sometimes, you know, there are garbage in, garbage out. All sorts of things are dumped there. Don't just go to social media and say, oh, this is what I saw there. This is the drug I saw there. Please visit. That's what I will tell you. I'm not going to tell you, oh, this drug will be good for you or this drug will not be good for you. No. I've just come to educate you, to enlighten you, to open your eyes on the need for you to regularly visit the hospital to find out your status. How am I doing? What is my state, you know, in my reproductive organ? How are my reproductive organ doing? How is my cervix doing? Is my cervix doing well? What should I do? What are the things I can use to prevent cervical cancer? That is what I've come to tell you today. On drug usage, come to the hospital. By the time you come to the hospital, you visit an O&G, you know, they will not tell you. If your own will require drug, they will tell you. Like the treatment range from, you know, drug, chemotherapy, then radiotherapy, and what? And surgery. All these are the 3 things that can help the woman bail out when you are detected early. But if you don't come on time, by the time the cancer have spread to the blood, to the bones, so everywhere, then you know, even to the brain, which means this person is already going. That's why we need to look for ways to prevent this. How can I prevent it? Visit the hospital, see a doctor, let them do a checkup for you, let them do a pap smear for you, let them check at your state, as at today. Then in another 1 year, you can make it it's a yearly thing. Start this November or start this December. Use it to do Christmas. Let it be an annual thing. Every December, I always go. Or every November, I always go and check
on your birthday.
Your state. Thank you, my sister.
A treat. 3-5.
Yes, on your birthday, use it to always mark your birthday. Use it to mark your birthday. On your birthday, just walk to the hospital. Doctor, today is my birthday. I want to check, the state of my cervix today. Doctor will just laugh and be happy with you. Please, my women, let us care for ourselves more than we care for, our clothes and our gold. Yeah? A woman will come and be using something that is not important to laugh at you, and you'll be considering it. Use your head. That sickness when they carry, when they carry hypertension, don't mind that person. The one the person is carrying might even be heavier and bigger than your own. Don't mind anybody. Live your own life, my women.
Okay. Don't come and live my life for me. Live your own life. A word is enough for the wise. Thank you very much, Stella, for finding time to be with us on this program.
So much.
We're going to invite you again because you have really educated us. You've educated us, and in trying to educate us on all of this, you also entertained us. That's what this is all about. So, woman, your health is in your hands. We'll see you again next week. Bye-bye.